problem of pressure injuries has become a huge challenge for hospitals. Patient acuities are higher, length of stays are longer, and the work of caregiving is much more complicated. Did you know that on any given shift, 50 to 70% of your patients will have at least 3 high-risk factors for pressure injury development? What that all means is hospital-acquired pressure injuries are more common than ever, and your work to protect your patients from pressure injury wounds is now more important than ever. There are a lot of things you have to do to prevent pressure injuries, but none is more important than getting the pressure off and keeping it off. When it comes to keeping the pressure off the lower back for an extended period of time, what you need is a cushion that lifts and supports from underneath the patient's back so that the patient's got even support across the whole torso, but no pressure on the sacrum coccyx area. When done correctly, your patient is more comfortable and can tolerate the offloaded position for a longer period of time. Less pressure for a longer period of time means less risk of pressure injury. So for purposes of positioning someone so that there's no pressure on the lower half of the back and no pressure on the heels, we want that musculoskeletal alignment without having contact pressure to these spots. We want to keep them perfusing to minimize the risk. So we want to turn somebody, in this case we turn and support them at near 30 degrees. Why 30 degrees? Because 30 degrees is about this much tilt. At a position of 30 degrees, we can get pressure off the lower back, we can get pressure off the heels, but we don't actually put pressure on the sides of the hips, called the greater trochanter. The longer we can reduce the pressure to these spots and position them such that they're in perfect alignment, where their circulation is flowing to these areas as best as possible, and that they can stay in this position, that minimizes the risk of pressure injuries. So what we're going to do is focus on what the perfect musculoskeletal alignment position will be in a turned 30-degree position, and how to get that optimal position and how to make it last as much as possible. This is a cushion I designed for 30-degree lateral positioning because I wasn't really happy with anything else that was out there. It is a low-profile cushion, so it's capable of supporting a person and lifting from under the patient, lifting both the hips and the rest of the back in an even musculoskeletal alignment. It has a breathable fabric, so it's skin-friendly. It is a little bit slippery to minimize friction and shear, but it allows gas exchange. It's a much softer feel, and so it's possible to get a nice soft lift, especially for people who can't tolerate these hard positioners that force them over too far. Now, you want the patient to be over as far as possible. If you want a maximum lift, you want the cushion to be as close to him as possible. Now, as you can see, if I tuck under here and tuck under here, when he rolls back over it, it's going to support his buttocks and support his hips, but it won't touch this area here that's sensitive, the sacral coccyx area. So to get the greatest lift, you can have him, roll back over it. You can have it really close and tuck it in. Now, as you can see, you've got a really great lift here, an angle, but it's supporting both his hips and his back. Is that comfortable, Dave?
Yes, it is.
Okay. You can check to see if you're avoiding the area that you're trying to avoid. Okay, roll over. Now, one of these things is, one of the features of the cushion is that this gap here is where you can provide space for wounds to be. So if he has a wound on his buttocks, or if he has a very large wound on his sacrum, you can position it a little bit lower so that it's actually circumventing. Even if his wound is very large, his scapula might have a little gap if he's a taller person. Now, if you do that, his upper shoulder might need a little support, and you can use any small pillow or even a large pillow to fill that space. Now, the other advantage to placing the cushion a little bit lower is that you're going to transfer weight over to his lower sit bones as you raise the head of the bed. So, as you can see here, as I raise the head of the bed, the weight's transferred to his sit bones, and the cushion actually curls. So you can see here, he's still actually turned off of his wound, but his weight is still supported on his buttocks, which is not something all the other cushions can actually do. Now, a lot of people ask me, Gwen, does this prevent pressure injuries? But my answer is, of course not. It's just a cushion. Neither do these cushions prevent pressure injuries, neither does this nice bed, neither do pillows, and neither do creams. They're just tools. The only thing that can prevent pressure injuries is a caregiver using the correct tools and supplies properly and applying the correct care. But I can say that this isn't just a cushion, it is the best positioning cushion available, and you should use it for your patients. Pressure injuries are the result of a series of complications with the patient and with the prevention process, and achieving adequate and long-lasting offloading is just one of the many things you have to do to prevent pressure injuries. If you want to learn more about the backbone positioning cushion, please give us a call, 650-294-8557. Our website is jewelnursingsolutions.com, and our email address is support@jewelnursingsolutions.com. Thank you for listening, and I hope to talk to you soon. Take care.